Hi, my name is Dr.
Gaukhar Baidildinova.
This video is a part of my lectures on evidence-based medicine and epidemiology. I found 6 types of randomizations. They are also not mutually exclusive, as are the characteristics for placebo controls. It's simple randomization, when we assign people to groups by flipping a coin or dice, clustering, block, stratification, minimization, and randomization by body halves or paired organs, split body trials. Before we talk about cluster randomization, let's define what a cluster sample is. Cluster sampling is a technique used when a population naturally divides into relatively homogeneous groups called clusters. The entire population is split into these clusters, and a random sample of clusters is chosen. Data is then collected from every element within the selected clusters. Ideally, each cluster should be a small-scale representation of the entire population, meaning the individuals within a cluster should be as diverse as possible. This method is often useful for interviews and can also be applied to clinical trials involving multiple clinics or hospitals. Example: if a researcher wants to interview apartment residents in a small town with 100 buildings, they might randomly select 10 buildings and interview all residents within them. Despite not sampling every building, the sample remains representative of the town's population. This leads to the concept of the unit of randomization. In cluster randomization, the unit isn't a single individual but an entire group, a cluster. For example, clusters could be students in the same school, residents of the same village, or patients in the same hospital. Each cluster is treated as a single study unit and is assigned to either an active intervention or a comparison group. Block randomization is a technique used to ensure that subjects are evenly distributed among groups. The number of people in blocks is determined in advance, e.g., 6 people each, 8 people each, etc., and then people are allocated one at a time to one of the groups. This is mostly critical for studies with small numbers of people, so it does not turn out that out of 100 people, 85 are in one group and 15 in another. If you have 6,000 people and one group has 2,300 and the other 3,700, there is no problem. An example from an ovarian cancer RCT article. Participants in a block of 32 were randomly allocated in a ratio 1:12. Stratified randomization is a technique that ensures that an important outcome variable, a potential distorting factor, is more evenly distributed between two groups than would be guaranteed by chance alone. Stratification ensures a balanced distribution within each combination. For example, when studying the effect of heart failure treatment, the degree of heart failure present will be a baseline variable predicting outcome, so it must be the same in the two groups. So, you first assign people to groups based on the severity of their heart failure, and then within each group, you assign them to treatment A or treatment B. However, it is advisable not to stratify by several variables at once, otherwise you will have groups that are too small. For example, in the case of patients with heart failure, it no longer makes much sense to divide them internally into different age categories or by the presence or absence of diabetes. An example from an article on pregnant women and newborns. You can pause and see the description of stratification. I also have 2 paid courses on Udemy. The Critical Assessment of Clinical Studies teaches how to read and critically evaluate clinical studies. It's a very great course. The same as my second course, Scientific Writing, where I tell all the nuances of how to write a scientific article or dissertation. Links are in the description box. Minimization. First, let me explain in simple terms before giving the formal definition from the article. When stratifying patients by multiple factors, such as gender, age, and region, you create many small groups, making it difficult to maintain balance. To avoid this, we assign numerical values to each parameter, usually in a dichotomous way. For example, for male sex, we assign 1, for female, 0. For being a smoker, we assign 1, for non-smokers, 0. For categorical variables with more than 2 levels, different point values can be assigned accordingly. When forming groups, we ensure participants have similar total scores based on key risk factors and disease severity. For example, one group might include a 30-year-old male smoker who exercises, while another includes a 40-year-old female non-smoker with a high BMI. This method helps maintain balance across important variables without creating too many small subgroups. Now, the official definition. Minimization is an adaptive stratified sampling technique used in clinical trials as described by Pocock and Simon. The goal of minimization is to minimize the imbalance between the number of patients in each treatment group on a number of factors. Usually, patients are randomly allocated to treatment groups, and while this maintains a good overall balance, it can lead to imbalances within subgroups. For example, if the majority of patients receiving the active drug were male or smokers, the statistical utility of the study would be reduced. It generally provides a better balance than block randomization, especially with more stratification factors. Another example from articles: participants were randomized using a minimization algorithm. Half-body or paired body randomization, split body tests, is the scenario most commonly used in dermatology and ophthalmology practice, where one intervention is performed on one half of the body and the comparison intervention is assigned to the other half. This can only be realized if the experimental treatment acts locally. Randomization is used to select which side of the body receives which drug. The upside is the elimination of mixed factors between trial groups because the baseline characteristics of both groups are the same. The disadvantage is the difficulty of blinding the investigator and the effect of therapy administered on one half of the body on the disease of the other side, since the halves of the human body are a continuum and not entirely independent entities. The distribution between paired organs, split skin, may hide systemic adverse events. In this scenario, statistical analytical tests of paired data should be performed. I found an article with this design as an example. 5 people on their different hands were used to see the effects of a treatment cream.